action today against gender-affirming care for kids. The U.S. Department of Health and Human Services unveiled a series of proposals to ban certain procedures and medical devices. Our Brittany Miller talked with the LGBT Life Center about the move.
This is probably the most hateful and problematic and deadly type of policy that they're looking to implement.
Thursday, the Department of Health and Human Services proposed 6 new actions against gender-affirming care for kids, including cutting off federal Medicaid and Medicare funding from hospitals that provide related procedures.
So-called gender-affirming care has inflicted lasting physical and psychological damage on vulnerable young people. This is not medicine, it is malpractice.
Stacey Walls is the CEO of LGBT Life Center in Hampton Roads. She says the decisions made by Secretary of Health and Human Services Robert F. Kennedy aren't rooted in science.
He's not a medical professional, and I don't believe that there's a clinician or a physician that would say those things.
While Virginia is one of nearly 24 states that have not banned gender-affirming care, Walls says the new proposals could make finding care difficult because of the threats to funding.
It is accessible in Virginia, but it's not as accessible as it used to be, and it's not as accessible as it should be.
For Walls, there are other things the government should be focused on.
Beyond imaginable that the administration is spending time on this versus health care for all adults.
And 13 News Now reached out to local hospitals, and we heard back from CHKD. We're told the hospital never offered surgical gender-affirming care and suspended certain other gender-affirming care options earlier this year. CHKD continues to offer mental health services to children affected by the proposals.